As people pop on, if you can say hello and let us know that you're there and let us know who's watching. If you're coming in later on and watching this on the replay, if you can just put replay in the comments and we know that you stopped by, that'd be great. So welcome to, Monday Night Positive Vibes this week. I am very excited to introduce our guest tonight, who is Stella Barnett. She is a canine rehab therapist and the owner of Pause in Motion Canine Rehabilitation in Muskoka, which is in Ontario, north of Toronto, right? If people don't know.
Yeah, like 2.5 hours north.
Okay. Stella is also a physiotherapist by background, and she also has a diploma in athletic therapy, and that I did not know. So welcome, Stella. I'm super excited to have you join us tonight to talk about laryngeal paralysis and also geriatric onset laryngeal paralysis and polyneuropathy, which I think is probably why people call it GOLPP, because that's a mouthful. So I always like to start by asking canine rehab therapists that I have on just to tell me how they got started working in canine rehab.
It's a bit of a roundabout way. So I qualified as a physiotherapist in England, and I worked with horses, and I worked at a riding school for children and adults with disabilities. So I always thought I was going to be an equine physio. And in England, you can do a master's in veterinary physiotherapy. So that was always my plan. But then I ended up moving to Canada. And when I came over here, there was not a diploma in canine rehab. It didn't exist. Yeah. So that's kind of since I've been here.
Yeah.
I looked into it and I was like, oh, there isn't really any formal training. And it sort of fell by the wayside until I got my first dog, and we were doing agility a lot with him, and he got injured.
Mm-hmm.
And we went to the vets. He was on anti-inflammatories. We were resting him. He would get a little bit better. Every time we tried to bring him back to activity, he was limping again. And then we rest him and do more anti-inflammatories. And I kind of started thinking, if this was a human client, I wouldn't be telling them to just rest. We'd be doing something with them. But I didn't know what to do. And I went to canine rehab, girl down in Toronto. She'd done one of the courses in the States. And we kept him, and he did great. And he competed in agility till he was 11. So sort of after I had done that, I thought, hey, I used to want to do this. And I looked into it, and the diploma was a thing.
Mm-hmm.
That was that.
And the rest is history. So when did Pause in Motion come to be?
I started working, I think it was around 2013 was when I sort of started dabbling in doing it. And then it's just gradually got bigger, a little bit bigger from there.
Awesome. So I know the reason why, but can you tell us a little bit about your experience that's caused you to know more about laryngeal paralysis, or LARPAR as it's, I guess, known on the street, and GOLPP?
Yeah, so my agility dog, Hartley, he's a half Labrador, half standard poodle. Always been very fit, very active. He competed till he was 11. But he was never great with heat. It was sort of something I noticed, that he wasn't very heat tolerant, and that definitely got worse as he got older. And I can remember his annual physical the year after he retired from agility, just saying to the vet, oh, he's got a little bit of like old dog noisy breathing. Didn't really think anything of it. She's, oh yeah, he's probably got laryngeal paralysis. And that was kind of it. That was the end of the story. Oh, okay, fine. But then I started noticing other things, like his bark changed. And he started to get a little bit noisier when he was exercising, and started to see a little bit of back end weakness, which again, I'm like, he's a big dog and he's getting old. But he started to show neurological stuff too. And just as the breathing has progressed, I was said to the vet, I was like, I think he has GOLPP. And she's like, yeah, he probably does.
Okay.
It's very kind of pragmatic. So that is what sort of led me to start to look more into it. And his sort of symptoms all came all together and progressed together, which is not typical. A lot of the dogs will have the breathing stuff first and the neurological stuff comes later. I wouldn't say he's progressed quickly. He's just progressed a little bit differently.
And he's how old now?
He is almost 13 and a half.
Okay. So it's been about 2.5 years since you've started to notice these things
Yeah.
happen.
Yeah. And he's a pretty big guy. He's 70 pounds. He's not small. So
Yeah. So we've kind of put the cart before the horse here. So if we rewind a little bit and go back, what is laryngeal paralysis or LARPAR?
So there's two different kinds. Sort of in a short term, and I'll go into a bit more detail. Laryngeal paralysis is where the nerve that supplies the muscles of the larynx stops working. And the muscles of the larynx are what they open when you're breathing and they close when you're eating and swallowing. So those muscles get very floppy and they stop moving out of the way as you're breathing. There's a juvenile version that happens in dogs very, very young, usually only a few months old, which is totally different, totally separate from what we're talking about. And laryngeal paralysis used to be thought of as just being a condition on its own, just this sort of old dog, their breathing is affected. And what they've started to see, and the reason why the name has changed to be GOLPP, is that the laryngeal paralysis is a symptom of a much bigger body-wide condition. It's not just something that happens on its own.
So are they always, so if it's not a young dog and a dog is diagnosed with LARPAR, are they really being diagnosed with GOLPP all of the time? Or do we know the answer to that?
Yes. There's other conditions that can mimic it or have breathing effects, like tracheal collapse and those things, which is different. So yes, I would say, especially in your sort of your large breed dogs and Labradors, it's probably GOLPP. And they could be, I mean, the statistics that I read said that they can be diagnosed even as young as 6. And like my guy was kind of probably closer to 12 before we started to really sort of think that something was going on. Yeah, so you'll hear their breathing gets noisy because the muscles are kind of flapping as they're breathing. And then if they're exercising or getting excited, then they can get what they call a stridor, where it gets really noisy and almost kind of whistling as the airway is getting narrower and narrower. There isn't really, I was looking to see kind of if there was an equivalent disease or disorder in people. And the closest, it's not the same, but the closest to help people to understand would be like ALS or Lou Gehrig's disease. It's a slowly progressive neurological degenerative disease that is hereditary.
So do you know if Hartley's parents had it?
No, I don't know. And he was, I mean, he's a doodle. So his breeder, she did do some health testing. Like she did hips testing, which is not always common in doodle breeders. So I don't know. And I don't know if she would really reply faster. I've often wondered if any of his siblings are still alive just because he is.
Yeah. And it'd be interesting because probably she wouldn't have known if her, bitch or stud had it.
Yes.
Until many years after you'd gotten Hartley, I would assume. Yeah.
And they're working on trying to develop a genetic test, especially because in some breeds it's so prevalent. Not there yet. Yeah. So the average age of presentation is actually around 11 years, but they can be younger, can be older. And I think we'd already said on the kind of little blurb about this that 70% of people are Labradors. So it's pretty prevalent in Labradors.
Yeah. Yeah. So what other breeds? Like, is it just all other large breeds or
so Newfoundlands, which have a genetic shared history with Labradors. And then some of the other giant breeds, golden retrievers, shepherds, German shepherds, and then Brittany Spaniels, which is, they're smaller. So it's a little bit of a, don't know why.
They needed some attention, I guess.
Yeah. And it is thought to be genetic. Some of the literature that you read says it's caused by dogs that were like pulling on their collar when they were younger. And that can cause some things, but they think that GOLPP is largely genetic.
It seems like a lot of things get blamed on collars, but then when you flip it and you go to look at certain conditions and the causes, they never mention collars. So it's just a bugaboo of mine, but yeah.
And the other thing is because to see your dog getting weaker and not able to use that back end as much, is that it's not a painful polyneuropathy. There's still, I mean, he still wants to chase his ball and he's happy and wiggly. And yeah, I mean, they're older. They probably have a little bit of arthritis in places, but the actual condition itself is not painful.
Yeah, absolutely.
So,
oh, go ahead.
Nope, you ask.
Yeah, I was going to say, so you'd mentioned the collars and about the pulling on the collars. Is there anything in the research that says anything about prevention? I mean, you kind of hinted about like genetic testing, and maybe eventually we'll be able to breed away from it. But is there anything else like diet or fitness wise? Like obviously your guy's pretty fit and this still happened.
Yeah, not really. There isn't really much that you can do to prevent it. There isn't anything that you can do to prevent it because it's largely genetic. And I mean, if they can find a genetic marker, and then sometimes with conditions, then they'll try and find the thing that triggers that switches it on.
Right.
Yeah, so we don't know. I mean, you can ask, especially if you're getting a lab, then you want to be asking the breeder, do any of your dogs or related dogs had laryngeal paralysis? And try and find out, or a Labrador mix too.
Yeah, absolutely.
Yeah.
So, Stella, for people that don't know what polyneuropathy is, if we put our science teaching hats on, and I mean, just for a lay person.
I made a list of kind of like the things that you might see as well, just generally. So, about 50% of them will have the altered bark. And what that is their bark gets just quieter, and it sort of sounds like they have a sore throat almost. It just gets really hoarse. Their breathing gets loud, and especially if the weather is hot and humid, they're worse. Or if you think of your typical happy Labrador, if they get excited or if they get stressed out, anything where they're panting a lot. Some of them will have a cough, and it sounds like they're clearing their throat. And that's due to, because their swallow can be affected as well, they can get saliva pooling, and that's what the cough is. They actually are clearing their throat. Yeah. Or if it progresses, they can start gagging. Reduced exercise tolerance because they can't breathe very well. And then the polyneuropathy is sort of the neurological bit. Usually you see it hind end progressing forwards towards the front end of the dog. So you might see them scuffing their back feet or hear them catching their nails as they're walking. You might notice that their back nails are a little bit worn down because they're catching their feet on the floor. Just generally a little bit weaker and a little bit wobbly in the back end. Maybe they can't get up the stairs as easily or onto the couch, or they might need help jumping into the car. My guy uses a ramp because I have an SUV, so he can't get in and out of it anymore. And then over time, it progresses to their front limbs and actually affects their trunk too. So it can affect their diaphragm, excuse me, and their muscles of respiration. And it's also, as well as affecting kind of your bigger muscular system, one of the nerves that affects the most is the vagus nerve, which is one that starts in the brainstem, and it goes almost everywhere in the body. It's a really, really long nerve. So it has effects can affect their organs too. So it can affect the vagus nerve goes to your heart, your lungs. It affects your swallow, liver, gallbladder, pancreas, spleen, the mobility of your gut. So it can be a whole body thing. My guy, whenever we've tested just like old dog blood work, heart, liver, has always been fine. But we have been kind of keeping an eye on it.
Yeah. So would the organs be a less common symptom, do you think? Or
I think so. I think because it's a progressive condition, especially with the bigger dogs, I think other stuff happens first. So if they're losing their mobility and they're a big dog and people can't help them to get up and around anymore, then that's going to be kind of
not be getting to that point.
Other stuff that is going on.
And I think it's important too, as you say all that, for people to recognize that it's a neurological condition, but there are so many neurological conditions. And I think the one that people always get worried about when they see their dog start to scuff or be wobbly is they're like, it's DM. And like, probably not. There can be so many other things.
Exactly. And then DM is another one that's slowly progressive, not painful. It's hard for us to watch. Often the dog is just like, oh, well, okay. I can't do that anymore.
They just keep going. They're quite content. But it's interesting the experience you had with your vet that was like, yeah, it's probably that.
Yeah.
But for someone that is not as educated as you, like there can be so much missed.
Yes.
Yeah.
And I sort of look back and think, I mean, we'll talk about treatment in a minute, but one of the treatments is surgery. And I sort of think if I had researched more back then, would I have done the surgery? Whereas, so I went with management, just managing his symptoms, keeping him cool, not exercising when it's hot. And now his neurological signs are progressing. And I think, well, I don't want to do surgery now because it's not going to affect him breathing. Is not going to affect his back end working better. Yeah, the timing, if people are going to do surgery, can be something kind of important.
Do you know how prevalent this condition is? Like number of dogs? Like I've never seen a stat. No, you don't either. No, yeah, because I'm not terribly convinced that. I don't want to sound rude, but that most vets know this is going on. Because I had a client recently that the dog has kind of a query heart disease, but even like reading through the vet notes, they just don't seem convinced that it's the heart versus the dog is just fat.
Yes.
He's having some like changes in his vocalization, and it's a lab, and it like a quiet but hoarse bark and just a funny breathing. And so they went back to the vet and I'm like, what did they say? And they're like, oh, it could be the heart or the medications. And I'm like, so I don't want to diagnose, but I was just like, so when he goes back swimming, if he starts to gag on the water, please go back to the vet. Like, And
I think a lot of vets still think of it as just the laryngeal paralysis rather than the bigger condition that this is a symptom of.
Okay. So I think you want to dive into treatment, but I'm curious to know more about Hartley and the story of you guys. Like you've talked about how you've noticed things change. So he's 13 and a half. He's still he's still mobile.
Yes.
And I mean, from what I've seen on your Facebook, still pretty darn active, right? Like he's living a good life.
Yeah, like the things I sort of really look at is he can still go up the stairs, one leg in front of the other. He occasionally will miss a back foot. And if he sort of slips, he can't get himself back up again. So I always go behind him up the stairs so I can grab him if I have to. Otherwise, a couple of times he's very gracefully kind of slid backwards down the stairs. But he's not a dog to like charge up them anyway. He's very kind of methodical. So he's not going to hurt himself even if he does slip. He can still pee on 3 legs. You can't keep it on 3 legs for very long, but he can still do it. And he can still do it to both sides. So they're kind of good little functional measures of what they're still able to do.
Find, the peeing, especially in a male, is a good cue as far as what they can pee. Oh, I'm so excited. They peed on 3 legs. Like, it sounds stupid. I'm like, no, like, that's awesome.
Yes. Can still do a tight sit, like tuck his feet right underneath him and stand up. And he was trained to use the paw pods, the four foot targets, and he can still do that.
Nice.
Which sometimes I'm amazed. I'm like, whoa. Because if you do the reflex where you put their foot upside down, it's pretty slow for him to correct. But I put the paw pods out, and he can always get all 4 feet on them. So we keep practicing that to remind him that he has back feet.
Yeah. Wow. That's awesome. It sounds like there's maybe a dog in the background there.
Oh, it's a rabbit. Rabbit trying to get out of a crate. But she's digging her way out.
She's probably not getting very far, I gather. So let's talk about treatment. And we've kind of, again, mentioned a little bit of the different things. Why don't we get the vet management part out of the way first?
Yeah, so there's very little medically that they can do. There are supportive things that they can do. So because the swallow and the gut mobility is affected, some dogs can get acid reflux. So they can put them on medications for that. And there are medications to try and get the gut contracting so that everything keeps moving in the right direction. through there. There's some people say that there's a drug that's an anti-anxiety drug that they think helps. The researchers are saying no, it doesn't help, and I'm wondering if it's just because a lot, Labradors typically get themselves very overexcited. If maybe just having them on anti-anxiety medication helps to prevent that, to get them into that state of excited panting. And so I'm not sure.
I can see most owners not being thrilled about a drug like. I mean, I've got a lab and I don't know. I just can't imagine drugging my dog to that point, but.
No. So there's surgery. It's called tie back surgery, and they go in through the neck, and they tie back one side of the larynx. They just stitch the muscle open so that half of the larynx is permanently fixed open. So that decreases the resistance to the air, allows them to breathe easier. But because one side of the larynx is now permanently tied open, they're at risk of what's called aspiration pneumonia, where if they swallow the wrong way or their food goes down the wrong way, there's nothing to close to prevent that from going into the lungs. Now, in advanced stages, even without the surgery, that can happen just because the larynx is so floppy that it's not going to prevent it either. So you have to be careful with that after the surgery. The way that they eat and the way that they drink, they often recommend that they're hand fed, and you have to smush their food into like little meatballs, and feed them a meatball at a time. Even without the surgery, they say if you notice when they're eating that they're coughing and choking and gagging a lot, you can try hand feeding them sitting up so that they're just at a better angle. Gravity can help, or feed them with them standing with their feet up on the stairs.
I read that and I just wondered how realistic that would be.
Right, especially if their hind end is weak, they probably can't. One of the podcasts that I watched, the researcher for that, she said it's kind of 50-50 whether it helps or doesn't help. You can try it, but she didn't feel that having like an elevated bowl or anything was any help. It's either you feed them in sitting or you feed them on the floor. All right. And then after the surgery, nearly all surgeons will tell people that the dog can't swim. And that's one of the reasons why I didn't do it, because my dog, he's half Labrador. He loves to swim. And I didn't want him to not be able to swim, because for him, that would be a quality of life thing if he couldn't do it.
Right.
There's one out there where she's I let my patients swim, but they're not allowed to dive. So they can swim, but they have to keep their head up. Don't kind of get them grabbing things, because
I think I saw, I don't know, I can't remember if it was a life jacket or a collar or something. And I don't know.
I think I've seen people make collars with a pool noodle to try and keep their head up.
I don't know. I've got the dog that likes to drink and swim at the same time. I don't know. I mean, you have to know your dog, right? Like you said, absolutely. Yeah,
exactly. And then surgery, depending on the age when they have it done, I read that the survival is typically 3 to 5 years after the surgery. So like we said earlier, the surgery makes it easy for them to breathe, but it doesn't stop the rest of the progressive processes that are happening. They're still going to lose their back end eventually. Other things that you can do is really watch, especially in Ontario where it gets hot and humid, really watch the times of day that you're exercising them. If it's really humid, maybe don't exercise them outside. Think of something that you can do in the house. Hopefully you have air conditioning of some kind. If you don't have air conditioning, try and leave a fan on the dog so they're getting cool air blowing on them, because that's one of the hardest things for them, is if it's hot and humid. Because they can't breathe that well, they can't cool themselves down very well either. So they can actually overheat.
Right.
Yeah. So cooling mats, cooling vests, give them frozen treats.
It's tough because I'm thinking of the one client I've got right now with this condition, and she loves, the owner, bless her heart, has mats everywhere, and she just wants to lie on the cold tile floor. And then physio. We can do physio. Yay for physio.
So the most important thing is we try and keep them mobile, especially with the bigger dogs. You know, you don't want to get to the point where you're having to lift them around the house or lifting them in and out of the car, because I always just figure at some point the owner's going to hurt themselves. Or
Yeah, absolutely.
So, so still getting them out for walks if you can, as long as it's not too hot, or maybe you need to go earlier in the morning or something like that. And then really working on their back end, so their strength back there, their body awareness, just trying to keep that for as long as we can. So sort of, I wrote down a list of my favorite back end exercises.
I was going to ask you for a couple, so you're prepared.
Yeah, and it depends. Some of it will depend on what the dog already knows. You know, my dog, because we did agility, we did a lot of conditioning stuff when he was younger, and I think he still has a little bit of that kind of muscle memory when I ask him to do stuff. So doing sit to stand is a great exercise for their back end. If they find it really hard to sit all the way down, depending on the dog, a nice way of doing it is to, if you kneel on the floor behind them and get them to sit onto your lap, and then stand up, and then they're only going about halfway down. So it takes 2 people because you need some to the front with cookies.
Yeah, sometimes depending on how, I don't want to say cooperative, but some dogs I can get them to back up towards something. So we'll sit on like their bed, or I love those cots, like and because I find that I can do it from there. So yeah, being creative.
Yes. Yeah. Trying to get them to do a tight sit. So get them on a plank of wood or an aerobic step or something, so that they're tucking their legs in under them as they sit, not sitting there with them just kind of splayed all the way out. So they're using the muscles to hold themselves in nice and tight. Standing and shifting their weight around. So you can either have them standing and you very, very gently just kind of like rock them. You can move a treat around in front of their face, so they're moving their head from side to side. You might stand them on a cushion or a pillow, so they're on something that's a little bit squishy. You can, in standing, if they know how to give you a paw, ask them for a paw, so that they're standing on 3 legs. And you really want to watch that they're not sort of tipping and twisting their whole body as you do that, that everything across their middle stays nice and still. So they might just lift their foot just a little bit off the floor.
And we want to do it on, sorry, my dog's decided she's going to come around. Is to make sure that they're on secure ground, so carpet or grass or something, so they're not slipping. So you don't want them to fall. Not
on hardwood or linoleum, or, you know, if there's somebody else at home, if you're at the front end, maybe they can just sit next to them in case they lose their balance. We really don't want that, right? We don't want them to hurt themselves doing their exercises.
Absolutely.
Yeah. Putting their front feet up on something that's, you know, only a couple of inches high, just so that we're shifting their weight back just a little bit, and you can get them doing those little weight shifting exercises again. Walking over things, so lay some poles on the ground, sticks, branches. Just have them walking backwards and forwards over them, so they have to pick their feet up to clear them. You shouldn't hear them ticking their toes on them as they walk past. And then you can teach them, depends how much fun you want to have. I love teaching dogs to do tricks. So
I'm really bad at teaching dogs to do tricks.
So if you have, you know, a piece of foam or something, put their front feet on it, bring them forwards, make them stop with their back feet on it. Can they go backwards and put their front feet on it again? Or like my guy, he knew the paw pods, so he puts all 4 feet on things because he's a bit of a show off.
Which is not an easy task to teach a dog. So if you try this with your dog and they don't do it, don't worry. My dog won't do it.
I'm like, I should do a little video on how to teach it, because it's really hard. And my young dog, I have a 2-year-old dog as well. He really struggled, and there was a lot of frustration where he'd be like smacking them across the room. And
oh man, that's funny.
And then other things that sort of transfer over from human physio, you know, because they're not entirely sure where their back end is, before you go for a walk, if you tickle their feet, you know, kind of get it right in between their toes and tickle the hair in there, wiggle the toes around, or I'll put my hand under their foot and I'll bump their foot on my hand, you know, try and wake up those receptors in their feet.
Yeah. If we think of like the athletes getting their like,
give their legs.
Yeah. I never thought of that. That's brilliant.
Yeah. Just wake everything up in there. And then if they do get aspiration pneumonia, those of us that have done human physio learn respiratory techniques as well. And you can pretty easily transfer those over to dogs to try and help with draining some of that gunk out of their lungs.
Cool. So maybe that's a good segue. How would an owner know if their dog had aspiration pneumonia?
They usually just sort of start to be generally unwell. They'll often go off their food, and they'll have a temperature. They may or may not have some kind of like cough or
they just don't seem right.
Yes. And especially if they've had the surgery, if they start to be a little bit off, I would think that's the first thing that you want to think about is get into the vet, get them x-rayed, get their lungs x-rayed.
And sooner rather than later.
Yeah, because it can go bad pretty quickly. Yeah.
So I think you talked a little bit about life expectancy. I think you said, I'm not sure if you said after diagnosis or after surgery.
That was after the surgery. I think, did I have one for? Yeah, so after surgery, 3 to 5 years, and without surgery, 2 to 3 years. And part of that will depend on the age when they were diagnosed and also the rate of progression. I think especially of the weakness. If you have a Brittany, they're only about 40 pounds. So it's a little bit easier if they're struggling with stairs for you to just pick them up and carry them upstairs. But if you have a 70, 80 or like a Newfoundlander, you're not going to be able to carry them up the stairs into your house. So, so I think the mobility for a lot of them becomes the bigger issue if you're managing their breathing pretty well. There are things that you can get to help with that, like your help them up harnesses, especially for the bigger dogs, ramps for your vehicles, steps for them to help them on and off the couch or on and off your bed if they sleep on your bed. And then I've been playing around with using, as part of rehab, we'll often wrap TheraBand around their feet and things. And with a lady that makes dog devices, we've been making some little cuffs that will go around their ankles with a hook on the front, and we tie TheraBand to it and loop it through the hook on the back of the harness, so that when they're bringing their legs through, the band tightens up and pulls the leg up.
Oh, okay.
Helps them to clear the ground a little bit better. I've got some video, but it's pretty grainy. I need to take some new ones. And with Hartley, it looks kind of funky, but it really helped him on the stairs.
Oh, yeah.
A little bit higher over the step. Yeah. So I'm going to try and get a better video of that because it's a super easy little device.
Yeah. So one thing, and I don't know your thoughts on this, one thing that I've been doing a fair amount of with my client that's got GOLPP is doing a lot of laser up around her neck and some manual therapy of her neck. I've taught the owner some neck traction. Do you do that sort of stuff with Hartley or your clients?
Yes. I'm terrible at treating my own animals.
The cobbler's children have no shoes.
But yeah, I've heard other people say that that's effective too. Yes, to do a ton of work on their neck. Obviously, their vagus nerve travels through their neck too. And if they're having trouble with arthritic stuff in their neck, then obviously it's going to affect everything else through here as well.
Yeah, I love doing just like cookie to the shoulder and just having everything move.
Yeah. So yeah, I mean, we want to keep as mobile as possible, like everywhere, right through their whole body. And then even though we know that a collar is unlikely to have caused it, once they have it, we don't want them pulling against the collar. So it's often good to switch to a harness for walks and things like that, just so that they're not putting pressure on that area.
Absolutely.
Yeah.
I'm going to just open it up. We can keep chatting just with the delay. If anyone has questions, please pop them in the comments for Stella or I. We will do our best to answer. If you're watching this on the replay, please still put your comments in there and I will make sure that we get answers to you because I think this is such an important topic. So any other thoughts on treatment or I guess management, Stella?
Keep them lean. So if your breathing is harder anyway, so we want to get them as lean as we can. Plus it's sort of easier on their joints and the rest of their body. And as an owner, if you're having to get to the point where you're physically assisting them, the lighter they are, the better. Yeah. And then trying to minimize that sort of incidences where they're going to get really overexcited or really overstressed. Because if they're panting a lot, the worst case is they can go into a respiratory crisis where they can't breathe anymore. anymore. And that's not something that you want to see happen.
Absolutely.
Yeah. Keep them calm, which I think is why some of the owners have started using like an anti-anxiety medication, try and prevent that from happening.
Yeah, because I can see that being very challenging with like the breeds that are affected, trying to keep the lab calm.
Yes.
Yeah.
Yeah. And then if you, other things is just, if you're not able to walk them, it's the middle of summer, it's really hot and humid, you don't want to get up 3 a.m. to take them for a walk, then just sort of finding other things that they can do. We don't want these dogs just lying on the couch all day. We still want to give them some kind of activity or stimulation. So feeding out of, do you know what a snuffle mat is?
Yeah.
Yeah, so using snuffle mats for feeding, or there's a company called Nina Otterson that makes games that you can hide. Puzzle games for them. Playing hide and seek around the house, so hide food or treats around the house and get them to go search for it. So they're still moving, but it's not super high intensity. And then do stuff with him. Hartley, I mean, he's always been a busy dog. That's why we got into agility. That we did tricks. We started teaching tricks, and I always thought that teaching tricks was kind of a little bit silly. But he actually got his trick dog champion at the beginning of this year. So that it kept me honest at getting him done.
Yeah.
The young dog, so it's really distracting because I'm trying to train him, and I should train you as well. You should have a turn as well.
Yeah, but I guess a lot of what you said is a lot of common sense things and things that we've talked about in this group, like traction, like supportive devices, like slings, steps, keeping your dog at a healthy weight, keeping them cool, keeping them moving, keeping them what do you think? Engaged with life socially and quality. Yeah. One thing that you touched on but didn't really touch on was the hand feeding. But can you talk just briefly about the type or the food that you feed a dog?
I think it's going to vary. Like if you feed kibble, what you can do is soak it so that then you can make it into these loose kind of little balls. They say like about a meatball size is better for them. If you feed raw, you're going to get your hands dirty because you're going to have to do that with that. Yeah.
What do you feed Hartley?
He's on a mix. I used to feed kibble, and I think as part of this condition, his guts just got to the point where they couldn't process it very well anymore. So my vet's not super happy because he's on raw. I switched him to that, and he does seem to do better with it. And I add a little bit of hand-cooked stuff, home-cooked as well, just for I try to add some extra fiber to his food to help it to pass through his guts better. So the cooked sweet potato added to his food.
I don't think most vets are happy when we tell them we switch to raw. I'm going to have that experience in a month, so we'll see what my vet does.
And then part of it was my young dog came on raw, so I was already buying it for him. And then Hartley started doing not so great on kibble, and I thought, well, I'm already buying it for the other dog. I might give it a go and see how he does. So, yeah.
So really, the purpose is just to prevent anything that's going to go down the wrong tube, essentially, right?
Yeah. So the thought being that if they're getting kind of a bigger chunk of food at a time, it's less likely to end up in the lungs. Versus if they were just eating little pieces of something, they're more likely to sort of be inhaling as they're swallowing, and it's going to end up in the wrong place.
Right. Okay, perfect. Do you have any other thoughts that you want to share, Stella, on LARPAR or GOLPP, which I think is just like the perfect acronym when you say it when we're talking about like swallowing and breathing?
GOLPP. Only that there is a pretty good Facebook group. It's called a Laryngeal Paralysis and GOLPP support group, and it has the word dogs in brackets. It's a really active, pretty knowledgeable bunch of people. So that's what I joined at the very beginning when I was starting to think, I think this is what he has. I want to find out, just sort of talk to other people whose dogs have had it. The majority of dogs in there are dogs that end up having surgery. There doesn't seem to be a ton of people in there that are doing conservative, non-surgical management. But it's still, it's a very friendly, nice group of people.
I was looking in there over the weekend, and there's some really good information in their files section too. If anyone's watching this, I can put a link to the group in the comments after this. for people that want to check that out too, because yeah, it is really good.
Yeah.
Perfect. So where can people find you if they want to find you, Stella?
Oh, on Facebook. So I have it's just Pause in Motion Canine Rehabilitation, my Facebook page. I'm reasonably active at posting stuff on there. Kind of goes in spurts, but that's the easiest way to find me. I do have a website too. Pause in Motion. I can't even remember it.
If you Google Pause in Motion Canine Rehab, you'll find Stella. I will make sure that we put an appropriate link in our comments for anyone that wants to
there's a lot of dog walking businesses called Pause in Motion too, which I didn't know when I decided on that as a business.
Yeah, there's one here in Kingston.
Yeah. But I have found that if you just stick my name in Google, it comes up too.
Perfect.
Yeah.
Awesome. Well, thank you so much, Stella. This was awesome. I learned a couple of things, and I'm going to go and start tickling toes and giving muscle rubs and such. Yeah, that's great. That's awesome. Thank you very much. And again, if anyone is watching this on the replay and you want to ask us any questions, please feel free to put it in the comments and we will get those answered. So, any last thoughts from you, Stella, tonight?
I don't think so. I wish that I had put together. I wish I had given you guys a picture of Hartley because he's a very handsome boy.
You can still put it in the group after the fact. He's been in the group before. We've seen his pictures, I think.
Yeah.
You can see more of him. He's a handsome man.
Yeah. So I think it's just sort of, it's a hard thing to watch happen, but just to not be afraid of it because he doesn't care. You know, he doesn't care that his back legs don't work that great anymore. And you know, he still wants to do stuff. And I'm always the one that's like, okay, take a break. You know, you've got to take a breath for a bit.
Yeah, and I think it's really nice to hear your perspective of someone that didn't go the surgical route because I think that is often, I mean, for vets, they want to be able to do something. So maybe they're offering that option and not really talking about, you know, the alternatives as much as they could be.
Yeah. Yeah. And I think, you know, it's that sort of, who is it? Who are you doing it for? Depending on the stage in the dog's life, how much better is it going to make their life, especially if their back end is already beginning to.
Absolutely.
Yeah.
Perfect. And on a positive note, like you said, it's not painful. So
yeah. They're happy. They're still happy dogs.
Perfect.
Yeah.
Alrighty. So we will end it on that note. So again, thanks so much, Stella. Thanks everyone for coming by and checking this out. And we will catch you again on another Positive Vibes. Cheers, guys.